Teresa Dufour with today's CT Style Express report. Moms-to-be, if you're giving birth during this uncertain time or planning to have a baby, Middlesex Health has you covered. Nurse manager from Middlesex Health Pregnancy and Birth Center, Amanda McDonald, joins us via Zoom. Amanda, thank you for chatting with us.
Oh, thank you for having me, Teresa. It's my pleasure.
So babies are being born during the pandemic, right?
Babies are being born during the pandemic. We are probably the one unit that did not have a decrease in volume. Moms were pregnant and needed to come have their babies in the safest way possible.
Sure, and talk to me about some of the extra safety measures that are now in place because of COVID.
So I think like everybody, we do have our PPEs in place. Everybody is masking. We are screening moms when they come in. Moms are being tested prior to admission. We're screening their support people when they come in, their temperature. We are still allowing our moms to have one support person with them because that's just, we're family-centered care and we want them to still have the best birth experience possible. We also have limited traffic on our unit, even from internally. Other employees from within the hospital don't come on our unit during this time when they used to. So we're doing our best to maintain a healthy atmosphere.
Sure, and something different at Middlesex is the role of a nurse navigator. Tell me what that's about.
Correct. So right now our nurse navigator is Alyssa, and what she will do is she will reach out to moms prior to admission to help them set their expectations, helps them to know what to expect when they arrive. She has virtual classes for them for question and answer so that they can understand our law policies. But really what it comes down to is she's there to help personalize their birth plan and to really make this their own unique experience.
And you talked about birth plan. That's something parents should have prior to going in, so at least a discussion.
Right, and everybody generally has an idea of how they want their birth to go. Some have a more formal plan, others just kind of let us know ad lib when they come in. But it's always good to touch base with Alyssa prior to admission because she'll let you know if some of your desires are possible or if some aren't, why we can't make that happen. But we are able to make every effort to meet all moms' desires. And it really leads to a very individualized plan for moms and very individual attention.
Sure, and talk to me about the extra care some babies might need and what's available at Middlesex.
So at Middlesex, we have a level 2 special care nursery. So some babies might need a little bit of extra care with low blood sugar, or some might be born a little early and need to be monitored a little more closely for what we call feeding and growing, and we keep an eye on them while we make them a little bigger. We also do phototherapy. A very common problem with newborns is jaundice, so we have to do phototherapy on some of them. And here at Middlesex, we do as much of that as the bedside with mom's bedside as possible, versus separating mother and baby and taking them to the nursery. So there's actually very little that it needs babies to be separate from their moms. They're able to stay together.
Sure, and on that note, skin-to-skin contact, is that still something that you can do in the current situation?
Absolutely, absolutely, and it's done immediately after birth, both in our vaginal delivery rooms and our C-section patients. Our C-section babies do go skin to skin as long as mom is feeling well enough and wants to. Obviously, it's parental choice as well, but it's definitely recommended for bonding and for cues, picking up cues for feeding later on. So we practice it daily and regularly.
Sure, and I know there are a lot of security measures to make sure babies stay with their parents and they go home with the right parents.
Right. I think they had to be more elaborate before because so often babies were taken from their parents' bedside numerous times throughout their stay for various testing and many different things, or just for mom to sleep. Right now there's so much rooming in that we encourage the baby to stay with their parents, but we have special bracelets that fit on both the moms and the babies. We have an alarm system that doesn't let the babies get near the doors without the doors locking down. So there's multiple layers in place to keep them safe, but really the safest way to keep them is keep them at the bedside with mom. So if we don't have to take them, then there's no way to separate them.
Absolutely, that makes sense. And there's also an online option for parents to be prepared before they get to the hospital.
Yes, particularly in the time of COVID, we had to get creative and find a way to do virtual classes instead of our prenatal classes. We also have prenatal yoga that's done virtually, and we're actually finding that our expectant moms love it. They love to be able to stay home and do the yoga in their living room with Ricky, our yoga instructor, on the computer. So my sense is going forward in the future, even when we're able to congregate together again, we may have to continue to offer the virtual learning because our patient population really seems to enjoy it.
Sure, the modern conveniences, I guess, right?
Absolutely, absolutely.
Amanda, thank you so much for all the information. And of course, you can learn more over at middlesexhealth.org.
Absolutely. Thanks again, Teresa. It was a pleasure.
No problem.
Take care.